we will talk to today with the subject oxygen reversal of coronary artery spasms with modifications, international standards for the diagnostic criteria of coronary vasomotor disorders. What's named Yasser's modifications of oxygen tests. This diagrammatic is very, very important. This shows the diagnostic criteria of coronary vasomotor disorders versus the new modification. This criteria, as you see, nitrate. This is the old diagnostic criteria: nitrate responsive angina, transient ischemic ECG changes, documented coronary artery spasms, versus the new criterion. The criterion oxygen responsive angina or Yasser modifications or oxygen tests. Let us to see the learning objectives, the starting points, abstract, vocabulary or keys for the current case reports, discovery history, identification of keys of the cases, case presentation, treatment, discussions, conclusion, and recommendations. Let us to understand this abstract. Let us to see the details of these abstracts. This is a study titled Oxygen Reversal of Coronary Artery Spasms, Modification International Standards for the Diagnostic Criterion of Vasomotor Disorders or Yasser modifications or oxygen test. Estimated enrollment is 17 participants. Study type observational. The observational model is case report series. Retrospective, the time was retrospective, started from December 15, 2018 to February 7, 2022. Analytic methods were comparative using percentage. Suggested purpose and research objectives. The effect of non-peric oxygen inhalation initially can improve the coronary artery spasm. The research objectives are to clear the initial effect of non-peric oxygen inhalation on the coronary artery spasm. The dramatic response of coronary artery spasm to oxygen inhalation will be guided to modify the international standards for the diagnostic criteria of coronary vasomotor disorders. These documents address criterion for vasomotor vasospastic angina are included the following: nitrate responsive angina, transient ischemic electrocardiographic changes, documented coronary artery spasms. This modification with oxygen will be added to the above three criterion. Ligability criterion, all cases associated with initial ST segment depressions. Exclusion criteria, cardiac chest pain with normal ECG. Assessment of treatment response was done with presence of eyes entirely reversible. This is named complete response of ECG ST segment depressions to oxygen inhalation, or incomplete reversal or partial response of ECG ST segment depressions to oxygen inhalations. Vocabulary or keys for the current case report series or study. Firstly, chest pain with or without ST segment depression. Oxygen role, the second one, oxygen role in the reversal of coronary artery spasms. Discovery history was accidental. Precise clinical and electrocardiographic observation is very important. I had been observing for important ECG changes after oxygenation. Principle of oxygen reversible coronary artery spasms with modification of international standards for the diagnostic criteria of coronary vasomotor disorders, Yasser modifications or oxygen tests. analysis for Yasser's modification or oxygen test in the author's interpretations are based on the following. There are, firstly, there are,
Dr. Yasser,
yeah.
Please share your full screen. Double click on your presentation, then it will be on full screen.
Again, I cannot share again.
No. Please share full screen.
Yeah.
Or
Okay.
you,
Okay. Thank you.
Yeah.
The principle of this modification is, firstly, there are ECG ST segment depressions. Secondly, there is a reversible of ST segment depressions after oxygenation. Thirdly, there is these ST segment depressions are transient. Fourthly, the ECG changes were reversed after oxygenation within a few minutes. Fifthly, there are no initial used medication to help this reversal. Sixthly, serial ECG traces are essential in understanding Yasser's modifications. Type of response for Yasser modification for oxygen test: entirely reversible or complete reversal, complete response of ST segment depression to the oxygen inhalation, incomplete reversal or partial response of ST segment depressions to oxygen inhalation. The target is ECG ST segment depression with or without chest pain. It's a very important point. Let me to introducing examples for understanding this. Case number 1 is carbon monoxide toxicity induced coronary artery spasm in a 14-year-old Egyptian single male adolescent student patient presented to emergency department with a sudden deep loss of consciousness in a hot bathroom in a closed space. The flushed face was noted on examination. His GCS was 9. The case was managed urgently and only with high concentration of oxygen inhalation using the nasal mask, 12 liters per minute. An initial emergency ECG, you will see. As you see, ST segment depression here, lead 2, lead ABF, lead 3, AVR also, and also in V1 and 2, 3, 4, V3, 4, 5, 6. Widespread of ST segment. This is before oxygenation. Within 20 minutes of oxygenation, as you see, tracing B is completely normalization of ST segment depressions. It does. Case number 2. This is a case of Cohen's Rafras syndrome. A 36-year-old Egyptian housewife, female patient presented to physician outpatient with angina chest pain. The patient gave a recent history of toothache. An oral 100 milligram of ketoprofen tablet was prescribed for the pain. The patient started to complain of acute chest pain within 30 minutes of oral tablet. On examination, the patient was anxious and irritable. Let us to see the initial ECG and serial. As you see, ST segment depression from V2 to V6. Limaros here nearly normalized of ST segment in P tracing. Case number 3. A 11-year-old Egyptian single female student adolescent patient presented to the emergency department with a sudden acute chest pain palpitation and abrupt loss of consciousness during also bathrooming in a closed space. The family gave a history of hypothyroidism on a single daily 100 microgram dose of L-cytotoxin sodium tablet. The flushed face was also noted on examination. GCS was 9. The case treated also with high concentration of oxygen inhalation, 12 liters for about 30 minutes using a nasal mask. An initial emergency ECG, as you see, ST depression, as you see in lead 1, 2, and 3, V4, 5, 6. And the AVF also. This is after oxygenation, nearly reversible for ST segment above ST segment depressions. Case number 4. A carbon monoxide also toxicity induced coronary artery spasm. An 11-year-old Egyptian single female student adolescent patient presented to the emergency department with sudden acute chest pain palpitation following a hot bathroom in closed space. The flushed face was noticed on examination. GCS was 15. The case also treated only by high concentration of oxygen using 12 liters per minute. ECG led us to see. As you see, there are technical error in first tracing, but there are the most important point here is ST depression in V4 to 6. After oxygenation with sinus tachycardia. After oxygenation, there are improved of ST segment, and also the sinus tachycardia mostly improved here in the second tracing. Case number 5 is iatrogenic alcohol inhalation inducing coronary artery spasm and sinus tachycardia in asthmatic and liver cirrhotic patient, 76-year-old married farmer male patient, presented to physician outpatient with tachypnea, dizziness, and chest pain. Refused sweating and acute confusion state were associated symptoms. The patient give all the history of bronchial asthma and liver cirrhosis. They give a recent history of asthmatic episodes 3 days ago. He acutely managed by other physician outpatient clinic. Physician outpatient only prescribed humidified oxygen needed within 30 minutes of presentation. The patient give a history of mistaken oxygen inhalation. This is the most important point in this case report. Using alcohol inducing coronary LCT depression, severe SCT segment depressions in ECG. You will see this mistake, high degree of mistakes take due to familial problematic in the patients. On examination, the patient appeared tachypnic, pale, sweaty, confused. GCS was 12. There is tachycardia during auscultation. Let us to see ECG. As you see, here is CT segment depression in lead 2 and 3, and VAVF inferior was also ST segment from V1 to is clear from V1 to V6. This is indicates there are extensive ischemias. This is after oxygenation. Appear very nice, appear normalized all SCT segment depressions. Case number 6, offer remains inducing PVCs and coronary artery spasm in 45-year-old married male football fan, workless, patient presented to the physician outpatient with palpitations, severe ischemic chest pain and dizziness. Symptoms are happened just after ending of match and the gain of his team. The patient is heavy smoker. Upon examination, the patient appear anxious, sweaty, and irritable. Irregular tachycardia were noted on heart examination. The initial ECG, you will see, as you see, multiple BVCs, but irregular. As you see, with there are ST segment depression from V2 to V6 in limb arrows. This is second ECG, more BVCs, which disappear. This is after initial oxygenation, and this might become ST depression only in V2 to 6. Here, completely clear of ST segment depressions after complete oxygenation. Case number 7. Mimic high lateral myocardial infarction with movable phenomenon, Yasser's phenomenon, and coronary artery spasm. A 54-year-old married farmer Egyptian heavy smoker, pale patient presented to the physician outpatient with acute severe chest pain, carpopedal spasm, tachypnea, and palpitation, lumpiness, and paresthesia, both extremities with perioral area were associated symptoms. He prescribed the chest pain as a twisting, agonizing pain. This is a new describing pain. What name? Chest tetany. New prescriptions. Severe twisting, agonizing pain. He gave a recent history of marked psychological stress. Upon physical examination, the patient tachypnic and stressed. The patient only treated with oxygen inhalation, 5 liters per minute. Ionized the calcium was mildly low. Troponin test was negative. Serial ECG, let us to see. Here, as you see, here there are strange sign in ECG. Here, like high lateral MI, ST segment depression in 1 and the AVL with ST was widespread of ST depression, as you see here in lead 2, 3, and AVF, with also wavy triple sign here in V1, 2, 3, 5, 3, 4, and 5, 2, 6, 2 V6. Here, only after complete oxygenation, there are improvement of ST segment of high lateral mimic myocardial infarction with disappearance of all ST segment. Case number 8. Fear-inducing coronary artery spasm in an asthmatic patient with right bundle branch block. 65-year-old married housewife, Egyptian female asthmatic patient presented to her shook his son in the physician outpatient clinic for cardiovascular follow-up. Upon physically, patient is good, not stressed. There's no wheezes on chest examination. ECG, initial ECG only indicate right bundle branch block. This is artifact, movable artifact. B, as you see, as you see in first one, right bundle branch with SCT segment V3, 4, and 5, as you see, leads. Also here, this more affected lead within a few minutes in the tracing P, as you see, SCT segment depression in lead 2, also with AVF inferior and added to V5, V2 to V6, widespread ST segment depressions. This is tracing the C after oxygenation. More is disappearance of all but persist right bundle branch blocks. This is indicates the right bundle branch is an old sign. Case number 9. And methods inducing coronary artery spasm in an elder osteoarthritic patient, a 70-year-old widow, housewife, Egyptian female patient presented to physician outpatient with acute anginal chest pain after psychological stress, but there are history. The patient gave a history of osteoarthritis since 15 years old. She has a recent history of sporadic different doses of endomethacin. On examinations, generally the patient irritable and stressed. She appeared obese. Let us to see the ECG. As you see, there are widespread ST segment depressions from lead 1 to AVF, also AVL. Here, V2 to V6, widespread of ST segment depressions with borderline of sinus rhythm, about 6-2. This is tracing 1, tracing 2, or tracing P. This are improved of ST segment after oxygenation, no more than this. Case number 2, 10. The phenyl-inducing coronary artery spasm in a single student Egyptian girl patient, 16 years old single student Egyptian girl patient presented to the emergency department with acute chest pain and palpitation. The patient gave a history of iatrogenic swallowing the phenyl tablet for 3 hours. Upon examination, this patient was agitated and stressed. ECG showing sinus tachycardia with, as you see, sinus tachycardia with ST segment depression in 1 and AVL. Here, ST segment also in 4, V4 to 6, but it is a mild. Here is a more clear in 1 and the AVL. This is tracing 1. Tracing B after oxygenation, as you see, there are improvement of with decreasing also of sinus tachycardia here from here to here, from first one to tracing to second one. Studies, data, and statistics. As you see, if you want to review this summary of history, clinical, and the management data for study cases. Age is average case age range from 11 to 70. The mean 43. Sex is a female. Sex predominant was 64.7. Occupation, housewife, students, and farmers, the most common occupations in this study. The main complaint is chest pain in 64, tachypnea in 23.4, 5, and palpitation 5.8. The associated risk factors: female 64, stress 23.5, carbon monoxide toxicity in 11.7, 2 cases. These are the most common associated risk factors. Average of inhaled of oxygen dose, duration minutes, mean duration about 22.7 minutes, median 20 also, minimal from 15 minutes to maximal 80 minutes. Dose per liter started from 5 to 11 liter, mean 5.5. Hyperventilation syndrome inducing coronary artery spasm was the most common. Here, 23.5. Carbon monoxide toxicity was 70.6. Stress induced coronary artery spasm 17.6. Outcomes responsive was either, as we talked before, complete response in 84.1 in 16 cases of study, and the partial 5.8 in 1 case only. Discussion. Role of hypoxia in pathogenesis of coronary artery spasm, role of hypoxia in pathogenesis of coronary artery pivotal and unavoidable. The imbalance between myocardial oxygen supply and demand is a key for development of angina pectoris. Exact mechanism in coronary artery spasm is still idiopathic. Reactive oxygen species decrease nitrous oxide and cause vasoconstriction, so oxidative stress, diphtheria dysfunction, and the low-grade chronic inflammation play an important role in pathogenesis of coronary artery spasm. Reduced oxygen supply is the main point here. However, if there are severe and prolonged hypoxia, vasodilatation pass off, and coronary coronary artery spasm results, causing vicious cycle for decreasing of myocardial oxygenation. Coronary vasodilation is caused by the reduced oxygen supply in the heart. Oxygen may stimulate the production of thromboxane A2 and since vasoconstrictor of prostaglandins, which is cause diminish the blood supply to the heart. Oxygen may increase thromboxane A2 production and reduce the formulation of vasoconstrictor prostaglandins. The role of inhaled oxygen dose that achieved the coronary artery spasm. Dose of inhaled oxygen that achieved the coronary artery spasm in the study varied from 5 to 12 liters, as previously mentioned. Maximum dose was 12 minutes. 12 liters. Then it was given for carbon dioxide toxicity. The duration of inhaled oxygen dose that achieved the coronary artery spasm in this study varied from 15 to 80 minutes. Maximum duration was 80 minutes, was given only in coronary artery carbon monoxide toxicity. Carbon monoxide toxicity is carbon monoxide paradoxically binds hemoglobin, as no, causing professional practical anemia. The carbon monoxide concentration of 100 ppb yield concentrated hemoglobin of 16% at enough equilibrium. The interaction of carbon monoxide to hemoglobin will rise depending on oxygen molecule at the three other different oxygen pending side, causing left side or leftward shifting to the oxygenation dissociation curve, the diminishing of the availability of oxygen to hyperoxic tissue will occur. Up using 100 of normoperic oxygen inhalation can hurry degradation of carbon monoxide hemoglobin with elimination of half-life of about 74 minutes. Oxygen supply to the heart results coronary vasodilatation. The decreasing of oxygen supply to the heart results in coronary vasodilatation. Severe or prolonged hypoxia will pass the dilatation of and the coronary artery spasm happen. Vicious cycle with more of a decreasing in myocardial oxygenation is the consequence. Coronary artery spasm associated with increasing of outflow of prostaglandins like materials. Coronary artery spasm will not appear to be caused by thromboxane 2 since selective inhibitors of thromboxane A2 senses enhance the hypoxic spasms and the coronary artery spasm. The mechanism of related loss of negative feedback mechanism control in the prostaglandin pathway occurred by thromboxane A2. Oxygen may enhance thromboxane in A2 production and decreasing the formation of vasoconstrictors of prostaglandins. The role of coronary artery spasm in many cardiac events reported, the paper presents a quite different mechanism of production of prostaglandins, a major factor in production of coronary artery spasms and sources of rhythm, which often accompany it. Coronary vasodilatation is caused by reduced oxygen supply to the heart. Relevant studies, unfortunately, there is no available relevant studies for alone use of oxygen inhalation in coronary artery spasm. The coronary arteries is conclusion. The coronary arteries, the coronary vasomotor disorders, international group of VATS represented the development of international standards for diagnostic criteria of coronary vasomotor disorders. The first symposium was held in 4 to 5 September 2013, sorry, and documented the criteria of coronary artery spasm, which included the following: nitrate responsive angina, transient ischemic electrocardiographic changes, and documented coronary artery spasm. But in my study, these criteria will be modified to add the fourth criteria by oxygen inhalation in the coronary artery spasm in the first initial criteria for the above 3.1 or yes, as named, yes, modifications or oxygen tests. Safety of oxygen in coronary artery spasm. The safety of oxygen in coronary artery spasm obligates us to avoid use the hazard modification tests in the diagnosis of vasospastic angina. This is especially if the propagate stimulus-inducing chest pain, transient ECG changes, and more than 90% vasoconstrictive response. Response of coronary artery spasm. In my study, the complete response of coronary artery spasm had happened in 94.1%. Despite this, the diagnosis based on nitrate responsive angina with associated transient ischemic changes, and despite being the mainstay of medical therapy for coronary artery spasm, but the side effects cannot be tolerated. Headache is the most common side effect, as known. For nitrate, about 10% are intolerant to nitrates due to disabling headaches and dizziness. Nitrate inducing hypotension is common. Nitrate rarely causing nitrate rebound may happen will experience of nocturnal angina episodes. Nitrate are contraindicated in use with concomitant use of BDE5 phosphodiesterase 5 inhibitors like Viagra for treatment of ejection dysfunction. As a combination of therapy may lead severe hypotension and even death. Chronic use of nitrates may lead to an increasing of mortality rate and recurrent MI. Some cases of coronary artery spasm whose attacks cannot be controlled, even with large doses of calcium channel blockers or combinations with nitrates. Reported case of 40-year-old man presented with attacks of coronary artery spasm resistant to combined given of nitrate, calcium channel blockers, and statins. Study limitations were absence of coronary catheterization and provocation tests for the diagnosis of vasospastic angina. Conclusions and recommendations: dramatic clinical relieving and reversible response of ST segment depressions after oxygen inhalation is an indication for its initial use in coronary artery spasm. Yes, modifications or oxygen tests for the past international standards for the diagnostic criteria of coronary vasospastic or vasomotor disorders improve patient safety and decrease the hazards of nitrates and other medications. Widening the research for the use of oxygen inhalation in the coronary artery spasm will be recommended. I wish to thank Engineering Ahmed Bari for technical support. At the end, thank you very much.